In today's video, I'm going to demonstrate an acupuncture examination and treatment. So first thing we're going to do is we're going to use an examination tool called an acograph. And what we're going to do is we're going to measure 6 points in the right wrist, 6 points in the left wrist, and then 6 points in both ankles. And that's going to measure the meridians and tell us how the body is functioning. So what we're going to do, we're going to measure this first meridian right here. And it's sending an electrical impulse through the meridian channel and measuring how well that meridian is moving. This doesn't hurt for the patient. They just feel me tapping on the certain points. You're going to hear different tones of the beep throughout the examination. That's going to indicate whether or not a channel is deficient or elevated like that channel is. And that could indicate an issue is going on. Switch hands with a probe for me. And let's check this side. Now you're going to compare left versus right, because sometimes if you have an injury on one side, it's going to affect the meridians on just that side. They should be evenly balanced though between both sides. Okay, let's go palm down. We do perform this exam at each visit so we can check the progress, because the patient's symptoms will improve along with the graph. Okay, and now we're going to go on to the lower body. Same thing, 6 points on each side. This will give us a baseline for the treatment, and then what we want to do after that is we're going to do some specific points for a specific condition that she's dealing with. And what we want to do with the acupuncture examination and treatment is just normalize the function within those acupuncture meridians, and that will allow the body to function optimally. Now it's going to have me remeasure any points that seemed out of the normal range. So we're going to remeasure a couple points. So switch the probe back to your right hand. We're going to remeasure a point on your left side. Okay, so at this point the examination is complete. I'll take that from you there. So at this point we're going to evaluate the graph and we're going to see how the patient is doing. You'll see there are certain channels that are blue, which means there's a deficiency. There's red, which means there's an increased energy in that channel. And then there's purple, which means there's a split between the right and left side. So that's again why we check both the left versus right. And really what our whole goal with acupuncture is to try to balance out the meridians and to make them all green on the graph here. So now what we're going to do is we're going to place some needles in the certain spots to help balance out the graph and to help the patient feel better. So this patient's just getting over the flu, so that's why we're going to see some elevated channels in certain parts here. So we're going to treat her lung meridian. We're going to treat the large intestine channel, which has a lot to do with head and neck congestion. Now what the patient feels with the treatment is just a gentle tap Some points may be a little more sensitive, but it's a very comfortable treatment. It's not painful at all. The needles will typically be left in for 20 to 30 minutes depending on the issue and the condition and how long the patient's had it. A lot of times patients fall asleep while we're doing the treatment and they can just relax and zone out. Now you'll see a lot of these points we're putting in are in the ankle, foot area, sometimes in the lower leg, and some in the hand. And the reason for that is these are some major acupuncture points that affect the whole body. We're also going to place a couple points in her ears and a couple on her face because she is congested still. And that will help loosen things up. Okay. How would you describe what it feels like for an acupuncture needle to be placed in?
I barely feel anything at all. I feel like the pressure of you tapping the needle in. Mm-hmm. It's not painful.
Great. And if a point is sore, a lot of times initially that will go away really quickly after we have the needle in for just a minute or two.
Once they're in, you don't even know they're there anymore.
Now the next points we're going to place are for sinus and head congestion. So this is a great treatment if you're dealing with sinus allergies or just have a cold that you can't get rid of. This will help loosen things up. Often it's an instantaneous release. The needles are about the thickness of a hair, and they're a solid filament needle, so unlike a hypodermic needle, which hurts because it has that hole for the medicine to go through, these needles do not cut the muscle or cause any disruption. Okay, so that's the treatment for today. We're going to leave these needles in for 20 to 30 minutes, and then I'll come back and we'll take the needles out.